They say when patients come to a hospital, they forget what the food was like, they forget their doctor's names, they don't forget what care they had.
It's very difficult when you come to this country because it's new life for me. And first time I was pregnant when I came here. And it's not easy to interpret exactly the way the doctor talked to interpret the person. It's not easy.
Porque mi niño necesitaba un rayos X que tenía un hematoma dentro de la boca. Y el doctor no me explicó que le tenía que sacar el diente al niño. El niño estaba muy miedoso porque le pusieron la camisa de fuerza y le sacaron el diente. No le puso pasta, no le puso ninguna anestesia y el niño estaba muy miedoso. Él todas las noches despertaba llorando con mucho miedo.
This project is intended to help students to access the healthcare system. There's quite a concern that many of you don't have access to healthcare facilities. Many of you don't understand the system.
For our community, understanding the language of healthcare is sometimes the difference between life and death. We want to build a bridge between people who want to learn and people who want to teach. We've accepted the challenge to explain healthcare without using a whole lot of fancy words, big sentences, and big terms.
When students see it in a book and read it and learn the vocabulary, it's not real until you come to the actual real place, the hospital. That just affirms everything that we do in the classroom. So the hands-on is what I'm trying to say is so important.
Now, triage is a term which basically talks about sorting out. We're trying to sort out who is the most sick and who is the least sick, okay? Who is the most injured and who has an injury that can wait a little bit. I do want you to keep in mind that sometimes there's some people inside that are much more sick at the time, okay? And I wish we could see everyone in 5-10 minutes, okay? But it's not always possible because sometimes things come in bunches and we have limited staff and we have to do what we can to get through it as quickly as possible.
The goal for managed care is basically to get everyone insurance. We have several health plans available, and as we come into the clinics, you'll notice that patients will congregate in one central location first. That's our customer service location. And what we would like each patient to have is insurance. Our mission at the hospital is to have them have insurance. Now, we are a city hospital, as I said before yesterday, that our mission is to treat everyone, regardless of their ability to pay.
After, when I went in the emergency room, it's very, 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 very beautiful, but it is different. And another hospital, maybe I'm from Africa. The people of Africa is not rich as the people of America.
Then we went to another very beautiful area, the maternity. It was the first time I saw a place to give birth so beautiful, because I give birth twice, but it wasn't so beautiful like this. They make the place where you are going to give birth, they make like, it's like a living room, because there is a bed, there is a computer. During your work, your husband can go to the internet. If you want to sleep, there is a couch, there is plants, beautiful picture on the wall. There is space. The bathroom, there is a tub, because usually there is no tub. And it's spacious. You can take a bath. The bathroom is spacious, because usually hospital bathroom are too small, too tight. It's only a shower, but there is a bath. The bath is beautiful.
And you can have your baby in that room?
Yeah, you can have the baby in your room, and there's another place for the older children. If you have older children, they can play over there. All the family can come. They make that. It's new, but it gives me like having another baby.
Yeah.
I think this week, for me, it was so motivating. Okay, we had a lot more excitement in our room this week than we had all semester. Mm-hmm. The attendance was better, and the work that they did was better. They did a lot of work. They worked together very well. They asked a lot of questions, and they were very surprised about meeting these people, how the people at the hospital were so respectful, how kind they were, and how they seemed to really care about their needs, which was very different from a lot of preconceptions that they had.
I feel like the goal of navigating the healthcare system, which is what this is all about, from the feedback that I got from my students, I think it has been accomplished.
Okay, now it's much easy for me to go to the hospital, to emergency room, to explain to different doctors, because I understand a lot of medical terms, and I feel comfortable now. I'm not afraid.
Okay, my name is Lucila Silva. I am studying clinical work with Ms. Tila Ilahi. And yesterday, I visited the Harlem Hospital emergency room with 6 classmates. And yesterday, I changed my mind. 2 years ago, I said I never back to the Harlem Hospital. But yesterday, I learned a new experience